I've worked as a nurse for 20 years, and the pandemic has been the most challenging period of my career to date. I struggle to imagine what it would be like day to day in a low-income country. It's difficult for me to imagine.
It was a very difficult time. We were really just scrambling to give the best we can. This particular pandemic has been really difficult for people with non-communicable diseases or NCDs.
The fear of living with a chronic disease and then contracting COVID would have been very real.
I can only imagine the stress that they have having to purchase all the medications, but they couldn't see their doctors. The clinics were all closed.
Possibly those people live quite fearfully with their health anyway, so add in a global pandemic and it must have made that situation very difficult for them.
People who have non-communicable diseases are more at risk of dying from this virus.
My experience of having an asthma is when I started to have colds, I would be very worried if it will not be addressed immediately. I would be in the hospital in 3 to 4 days. Nisaka na ang number of cases sa COVID. Diha na ko nag-start nga, burag, it would be time na. I can no longer sleep. Magsige na lang kung ubo, sige lang ubo. Saon ako di ko katog. 9 days of in the emergency hospital with extreme cough, without sleep. I cannot even lift a spoon to eat. I didn't even pray for healing, but I prayed for quick and peaceful departure. The nurse told me that we will have to intubate you tonight. I have heard most patients who have undergo intubation will not survive. So I said to myself, okay, this is it. My brother did not lost hope. He asked my doctor that, is there anything we can do for my brother? I slowly recovered. Even one step or two steps, I was really scared kay grabe gud ang pagkats nako sa breath. Life has never been the same again. So I cannot live a normal life. My lungs is 60 to 70% functional.
There are a lot of non-government organizations, people who just gathered themselves to really help us. We are very thankful for our partners who have really given us masks, meals, messages of encouragement to just continue. We do have a lot of opportunities to build back better. The way we gather data for non-communicable diseases has already been started with electronic medical records. We just need to strengthen it to make it easier for them to get to doctors, to get their medications, and to follow up and avoid exacerbations on their conditions.
It's stopped everyone in their tracks and made us all think of different ways of doing things. So I think we have to take those positives forward and reassess what's worked, what hasn't.